What tests are being done to monitor CLL over time?
As far as monitoring goes, usually the blood count alone is what is followed, and you look at the white blood cell count and see whether the lymphocyte proportion of the white count has normalized. The other tests, including bone marrow biopsy, are rarely required. MRD testing is gaining importance in chronic lymphocytic leukemia when you use certain classes of drugs like BCL2 inhibitors that produce deep responses. However, MRD testing can be done on the blood in this disease, and that, again, doesn't necessarily require a bone marrow biopsy to establish.
Patients with CLL are monitored with mostly blood tests over time. Namely, we do the complete blood count or a CBC that is done routinely at every visit. Another test that's used to monitor over time is the peripheral blood flow cytometry that was used in diagnosing a patient with CLL, and the same tests can be used in monitoring, tracking the disease as well. Some of the newer tests that are used in monitoring disease, your physician may perform a CT scan to look for response to the treatment and sometimes for monitoring the disease. However, this is usually not routinely performed. Another highly sensitive test that is used for monitoring disease on occasions is minimal residual disease testing or MRD testing. However, its use right now is restricted mostly to the research setting.
How can I learn more about my disease? Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
How often will I need to undergo testing during my CLL treatment and follow-up care?
The frequency of monitoring in CLL depends on how well the disease is controlled. Initially, you may need to monitor the patient even at a weekly interval after initiation of therapy, but once the disease has been well controlled, getting a blood test every 3 months to 4 months is sufficient.
During treatment, we routinely see patients every few months, sometimes every 2 to 3 months. And on those occasions, we perform the complete blood count and a flow cytometry test to monitor patients. Once they complete treatment for the first 2 years, after the completion of their treatment as well, some of these tests are performed every 3 months to monitor patients with the disease. The diagnostic testing typically takes a few weeks for the results to come back.